Which steroid creams work best for eczema? First of all, what are steroid creams? Steroid creams are anti-inflammatory agents that are used to reduce inflammation. They are useful for short-term use of conditions such as when you have a flare-up of eczema, and they're not intended to be for long-term use, which we'll talk about later. Apart from steroid creams, you have other formulations such as ointments, lotions, and gels. Out of all of these, ointments tend to be quite potent, they're quite greasy, and they're useful for very dry and flaky skin. While creams are used for all purposes, they can be easily absorbed into the skin. They're used for very hot weather if you're quite sweaty, whereas with the ointments, if that mixes with the sweat, that can actually introduce infection into the skin. So as I said, steroid is very effective for controlling flare-ups of eczema. Eczema is basically when you have dryness of the skin, irritation with redness, flaking, and you get very itchy skin, and you realize that emollients or moisturizers on its own are not enough to control flare-ups, and this is where steroids come in. So you've got different grades of eczema. You've got mild, moderate, and severe eczema. So in mild flare-up of eczema, you find that you need the mild steroids such as hydrocortisone 1% cream, which you usually apply twice daily. You can use it once daily if very mild, but most cases it's twice daily after a wash, morning and evening. A fingertip unit is equivalent to 2 adult hands. So if I had eczema on both hands, 1 fingertip unit from the top of the index finger to the crease of my finger would be enough for me to apply the steroid to both hands. 7 days is usually a sufficient period for which to use hydrocortisone steroid cream for mild eczema. If you had moderate eczema, it's very unlikely that hydrocortisone will be effective, so you need the moderate steroid cream such as Umovate. Now, Umovate is classed as moderately potent. Again, same application as hydrocortisone, twice a day to the affected areas only. Do not apply to normal skin for reasons that I'll tell you later. If you use the Umovate and you find that it's not effective, then you can try a stronger preparation such as Betnovate RD, which is a milder form of Betnovate, or you can try Betnovate 0.1% cream, which is classed as potent. So this you can use for moderate eczema. Again, same application, remember, apply very thinly due to the potential side effects. Another class of steroid in the moderately potent category is called Elocon. Elocon 0.1% can also be used as an alternative to Betnovate, especially if you find that Betnovate hasn't helped or Betnovate is out of supply, but my preference is usually to go for the Betnovate simply because it's cheaper and it tends to have less side effects than Elocon. However, if you had severe eczema, you find that you'd have to use very potent steroid creams. As usual, you can try Betnovate or Elocon first of all, but if none of these steroid creams are working, then you might have to graduate to Demovate. Demovate usually comes as an ointment rather than as a cream. So with the Demovate, usually you find that rather than using twice a day, once a day application is more than sufficient enough to control the eczema. Now, all of these creams or ointments are normally for short-term use. So if you have flare-ups, we normally advise ideally 7 days. Though in quite severe cases, you can actually stretch it up for as long as 4 weeks. However, it has to be quite a thin application and you have to reduce the frequency of the use of each week. If you look at my other video on controlling flare-ups of eczema, I discussed the weekender regimen where basically week 1 you apply twice a day, week 2 once a day, week 3 every other day, then week 4 you find that you only need to use the steroids on weekends only and you're gradually weaning off the steroids, which helps to reduce the side effects, which I'm going to mention. So possible side effects include thinning of the skin, easy bruising of the skin, hypopigmentation, where your skin is lighter than usual. If you notice hypopigmentation, you should stop the steroid straight away because the hypopigmentation can be reversible. However, if you continue using the steroid on that same area, not only is your skin going to get thin, easily bruised, as well as stretch marks, but you can get lightening of the skin, which is irreversible. Now, my son had mild eczema on his elbow and I thought I just wanted to get rid of the eczema quite quickly. So I applied Demovate for about a few days, but even after a few days of applying the Demovate, I noticed that that part of the skin has started to get lighter. Luckily, I had stopped the cream straight away and now his skin color is back to normal. I do notice that a few patients have told me that even in mild eczema, sometimes they do use the moderately potent cream such as your Betnovate and they only need to apply twice a day, which is not a problem. But if you continue applying it with an increased frequency and you're doing this on a weekly basis, then you can have side effects as a use of what we call prolonged steroids. Now, there are cases where patients have come back and say, "Doctor, the steroid creams are not working." And usually the question I would ask is, are you using the steroid cream on its own? You find that in most cases, a lot of patients are mixing the steroid creams with moisturizers. We normally advise do not mix steroid creams with moisturizers or your emollients such as your E45s, your double base, your diprobase, and this is because these moisturizers are barrier creams that prevent penetration of chemicals, irritants. Steroid cream can also be classed as an irritant. So if you apply moisturizer first, you find that the steroid cream cannot penetrate through the moisturizer to get through to the inflamed region of the skin. So do not apply steroid creams and emollients at the same time and do not mix them together because that reduces the effectiveness of the steroid cream. Ideally, you want to wait 20 minutes, whichever application you try first. If you have a flare-up, you want to apply the steroid cream first, wait 20 minutes, then apply the moisturizer. Once the flare-up starts to improve, then you can start applying the moisturizer first, wait 20 minutes, allow the moisturizer to absorb, then you can apply the steroid cream. Also, another question I get asked is, can I use steroid on my face? Ideally, you should try and avoid steroids on the face as much as possible, but if it's not preventable and you do have quite bad flare-ups of eczema on the face, then you can start with hydrocortisone 0.5% is recommended for use on the face because hydrocortisone 0.5% is very mild. It's milder than hydrocortisone 1%. You can apply it on the face. Again, a thin application once or twice a day and not more than 7 days because of the risk I mentioned, such as the thinning and light patches on the skin, which can be irreversible. In some severe cases, you can actually use Methotrexate or Umivate or hydrocortisone depending on the severity. However, you should not do this without advice from your dermatologist just because of the side effects. Most dermatologists would actually prescribe non-steroidal creams for the face, such as tacrolimus, 0.1%. Tacrolimus is a topical calcineurin inhibitor, which means it dampens your immune system. It can be used for long term as opposed to steroids, which ideally on the face should not be used for more than 7 days. These sort of topical agents can be used for as long as 6 weeks. But again, dermatologists will advise that there is a small risk of skin cancer or lymphomas from prolonged use of these calcineurin inhibitors such as your tacrolimus. So again, this should not be done without dermatology advice. Now, if you have an infection of the skin due to eczema and your barrier of your skin is exposed, you should ideally try to avoid using steroids. Now, this is a catch-22 because you want to control the flare-ups, but you advise not to use the steroids, and this is because the steroids can actually make the infection worse. So in some cases, your doctor will tell you to stop using steroids temporarily while you're given antibiotics cream or oral antibiotics, depending on the severity and spread of the infection, to control the infection. Once the infection is more controlled and the barrier of the skin is not as exposed, then you can start using steroid creams. There are occasions where you need a combination of both your steroid and antibiotic cream. So there are preparations such as Fusobet, Trimovate, Timodine that contain preparations of antibacterial, antifungal, steroid, and other ingredients that would help to control the infection while reducing the inflammation, which is especially useful in more localized infections than widespread infections. Now, going back to severe eczema, if you find that your Methotrexate, your Elocons, and your Demovates are not working, then this is the point where your GP really should be referring you to a specialist. But you also want to think about the possible triggers, because there are triggers that might be causing your eczema to be ongoing or prolonged. So could you be allergic to house dust mites, which are little mites that you cannot see with your naked eyes? They're usually found in your carpets, your mattresses, your pillows, and ideally you should change your beddings, your carpets every 3 years to prevent house dust mite, because you could hoover as much as you want, but you cannot get rid of these house dust mites. You also want to think about certain types of foods such as nuts, dairy products, cheese, yogurts, milk that can cause flare-up of your eczema, pets dander like furs from cats and dogs, even your clothes such as cotton, other allergies such as pollen, certain types of trees, changing the weather. This can all potentiate your eczema and cause frequent flare-ups and make it to get worse. And don't forget stress. Stress can also be a trigger factor for eczema as well. So therefore, other treatments will include trying to avoid the triggers as much as possible, changing your diet, speaking to a dietitian who can give you a dietary plan that helps to control flare-ups of eczema if you notice that your eczema is due to diet. There are other treatments such as phototherapy where you're being exposed to UV light. There is oral immunosuppressant medication such as oral steroids, which ideally should be used on a short-term basis because oral steroids have more severe side effects such as they can cause moon face, weight gain, there's risk of osteoporosis. Even steroids can affect your mood and cause mood swings. Then you have other immunosuppressants which are normally used for conditions such as psoriasis, rheumatoid arthritis, such as your methotrexate, your cyclosporins. These all have side effects. They can cause lung problems, they can cause liver problems, they can cause problems with your bloods, and they really dampen your immune system, which makes you more prone to infections. And then you've got what you call your biologic, which is like your human monoclonal antibodies. I mean, I cannot pronounce the names, but think of your inflamamab, your dumabs, they're all end in MAB, which is your MABs. And these are very effective for controlling flare-ups of eczema, but they're also very expensive. So usually they're given when nothing else has worked. Now, I hope you enjoyed this video. Please feel free to check out my video on using steroids to control flare-ups of eczema. And if you have any questions, please feel free to drop comments below.